There's a medicine we give sometimes in A&E that makes your heart stop for a few seconds. It's called adenosine, and we give it for a particular kind of fast heart rhythm. It's a kind of crazy medicine when you think about it. It's got a really short half-life. You got to push it really fast. If you give it in a hand cannula or in a small vein, it kind of breaks up and gets metabolized before it does anything. So you're pushing this drug real fast. It's going to wear off in a few seconds, and it makes the heart rate just slow down and flatline for a couple seconds, and then it comes back, and hopefully you're in the normal rhythm again. When I first came across adenosine, I remember the doctor who was doing it said, for the physician, giving adenosine is always a bit of a buttock clenching moment. He described it as, because you're just watching a patient flatline, and you're putting all your trust in your pharmacology that it's going to have a short half-life and they're going to be okay. And I'm sure he was pretty correct on that. Last time I gave adenosine was a few months ago. Very calm, lovely patient. She was one of these just do what you got to do, doc, don't worry about me kind of patients. But her husband was super anxious. There was a couple of medical students in the Bay and a junior doctor with me as well, because if something's going to happen, you don't see it every day, everyone tends to come and watch it. And I think all these medical people were making the husband really anxious. So gave the adenosine, pushed it fast, watched the heart rate come down. It was like 160, 120, 80, 50, 20, 0, and then flatline across the screen. And I just felt all these heads snap around to stare at me, wide eyes, panic, like what's going on here? And I just, remained calm, just tried to project a bit of confidence. I just keep watching the monitor, watch the heart rate come back, 20, 50, 60, and then just kind of back to normal. And everyone kind of breathed a sigh of relief, and I unclenched my buttocks.